Hi everyone, we're occupational therapy students from Milligan College in Johnson City, Tennessee, and we are here to talk to you all about sleep management and rest today. So in this video, we're going to talk about infants up until 12-year-old children. And it's really important for any parents, grandparents, or just caregivers and family out there to watch this video because obviously this is a really important stage of life and we're setting up for adulthood. So we want to make sure that we're getting adequate sleep and we have enough energy throughout the day at school and in play so that we can develop properly. So this is a really important video and we are going to get started talking about hours needed throughout the day for different ages of children.
So your kiddos need different amounts of sleep depending on their age. It's important for parents and grandparents to become familiar with this so they can establish a wonderful bedtime routine. Infants need around 12 to 16 hours per 24-hour period. This does include naps throughout the day. Your babies under 2 need about 11 to 14 hours. And your toddlers need 10 to 13. Now your older children, 6 to 12 years old, they need about 9 to 12 hours of sleep. And this, promotes a good, healthy routine.
Talking with the amount of sleep, you also need to have a good bedtime set for your child. So a time that you're going to start putting them to sleep and then that they're going to fall asleep. And that needs to stay consistent 7 days a week. It's really hard for children to have a bedtime during the week and then on the weekends change it up because then they have to readjust and that's really hard on them. It's also important that even with the older kids to try and just push the bedtime back but keep it consistent all 7 days of the week. We have our friend here to help us demonstrate some common bedtime routines that you can often see and use with your kiddos. You want to establish a consistent routine with your child and keep it the same each night. That routine could include picking up their toys, taking a shower, brushing their teeth, putting on their pajamas, reading a book, and laying in bed for a little bit. You want to give them incremental reminders throughout the bedtime routine, such as, okay, we're picking up our toys, but what do we have to do next? And then they could even answer that and say, we're going to go take a bath. And you're like, yes. And then what are we going to do after the bath? And they could say, brush your teeth. So you're getting your child involved so they feel like they have power over their decisions and it'll make them more okay with going to sleep. You also want to turn off all TVs and electronic devices about 30 minutes before bedtime so that way they're able to fall asleep easier and their brains are able to rest. One tip is you could play soothing music throughout this process so that way they are able to calm their bodies down and just really relax before they go to sleep.
So this is the information that we have for infants up until 12-year-old children. We have links below that focus on adolescence and adulthood, sleep management and rest, things that are really important for those age groups. So you all should really click on those links below and check them out because they're important across the lifespan. Thanks for watching our video. Bye!